I'm Tamara, and this is TELUS Talks with Tamara Taggart. We're bringing together experts, thinkers, and leaders, busting myths, sharing stories, and staying connected when Canadians need it the most. We're having unexpected conversations for unprecedented times. Hi, Dr. Tepper. How are you doing?
Good morning or good afternoon.
Morning. Yeah, exactly. Who knows, right? It's like Groundhog Day every day. You're okay if I call you Joshua? Or
Absolutely.
Okay, so you and your team are on the front line in Ontario. You're a family physician. You're also the CEO of North York General. So can you maybe give us an idea of what your day looks like or your team's day looks like?
Sure. So it's pretty different. It's pretty different, and it's been that way for a while now. So even just walking into the building, we've closed off all entrances except one. So now I'm only going in one door off to the side. We're physically distancing as we walk in. We're hand washing. Then we're being screened. Then we're being handed masks and visors, depending on what we're doing in the building, and then making our way through. Just walking through the hospital, it's a completely different experience. First of all, everybody's in masks. And second of all, there's just so few people here. Our volunteers aren't here. Most of the admin staff isn't here. All of our retail is shut. Most of our food places are shut. So it doesn't have that normal hustle and bustle that I love to feel in the organization. And we don't see the learners, the nursing students and the medical students and all the other students, in the building. So it feels different as I walk through the building. And then, I go to my office and then I start my meetings. And even if they're with meetings with people right down the hall from me, we're usually doing them separately. And so just the physical feel, the way we interact is very, very different than normal. By the time I've gotten up to my office, I probably washed my hands 3 or 4 times, et cetera, checked in with some of the ward teams, see how their night was or how their morning's going. And then how we structure our day is very different. All the things the future, as a CEO, I'm usually thinking about where do we need to be in 12 months, 2 years, 3 years. What I'm really worried about is how many ventilators were used last night. What's their capacity? Who's off sick? What are they off sick with? And we go into incident management meetings and sort of command center meetings at different points through the day in a very structured way. So the day-to-day is very different. And then on the nights or the weekends when I do clinical care, normally I go down to my clinic, and instead it's all Skype or Zoom or phone calls. And so even the clinical practice that I do in the nights and the weekends feels just so incredibly different.
Do you think that, we're doing so much virtual care now. I've noticed, my family doctor's office is, sent out emails saying that it's all virtual right now.
Mm-hmm.
Is this, is this the future? Are we going to be wearing masks in the future? Are we going to be, seeing our doctors virtually? Have you thought about what the future looks like?
I spend a lot of time thinking about that now for lots of reasons. And I think we all do. My hope in, some ways is that we've made a bit of a breakthrough on virtual. I think Canada and many countries have lagged behind the adoption of virtual in healthcare compared to other sectors and other industries. And so obviously a lot of, certainly a good chunk of what we're doing virtually now does need to go back to face-to-face. But I am hoping that we say, wow, this actually worked pretty well for certain things. And so we won't go 100% back. We'll actually say, we can't do it all virtual, but let's really see what did work well. Let's improve upon it. What technologies work? How do we ensure some of the security, payment models, all the questions that are being raised now, but let's make sure we just don't flip back to basically 100% face-to-face, because I think this has taught us that actually virtual works well for certain things and certain types of interactions, and how do we keep some of that progress?
Mm-hmm. So let's talk about Ontario specifically, because you've had a much different experience than British Columbia, where I am right now. When it comes to COVID-19, you have many more challenges, I guess. So can you speak to some of those challenges that you guys have been facing over there?
As a healthcare system?
Yes.
I certainly think we've been, I would argue, been sort of 2 or 3 phases So one phase was absolutely building up the hospital capacity, a huge pressure about ventilators, creating ICU intensivist capacity, et cetera. The next thing that we really find ourselves in right now is actually focusing on long-term care, homeless shelters, congregate living. Maybe I think a case could be made. We should have perhaps turned there a little bit sooner and been a bit more preventative, but that's where we are right now. And so I actually spend a lot of my time as a hospital CEO. My day-to-day now is really focused on long-term care homes in our community and how do we support them, how do we work collaboratively with them, and how do we really protect the residents there and the staff that are there, and how do we collaborate using some of the knowledge we have in the hospital and the resources.
And what are you, I mean, you must worry about a lot of things. I think we all do, especially in a time like this. But as a medical professional, what are some things that, are always on the top of your concern list?
I think, to be honest, one of the things that worries me the most, it's not is my colleagues, is the team, is the nurses, the doctors. This is a really hard environment to be working in. Just the physical nature of working at sort of different capacity with the personal protection, the stress that families have, the stress that patients have, the emotional as well as the physical weight of working in this pandemic is huge. And I'm really mindful of that weight. I think everybody in society feels the weight of the physical distancing and the kids at home and, enough toilet paper, like all of that stuff that, every single nurse and doctor and respiratory therapist and lab technician, they have all of that going on that everybody else in society has. But then they've got to come into work and they've got to be working in an environment with incredibly sick people, with people who get sick very, very quickly, with a disease we don't know a lot about, with families who are not allowed at the bedside or to visit and have tremendous understandable frustration and anxiety about not being with their loved ones. They worry about their own health and safety, their safety of taking it home to their families. And so they have all the things that everybody else does, and then the added reality of being literally at the clinical coalface of this. And I'm just very mindful of that and what that feels like to thousands and thousands of people every day.
Yeah, because it's so much more than just nursing someone back to health. There's a lot going on. You're right. And how safe are, like maybe you could paint what an ICU looks like during COVID. Maybe that would be, help us understand what a healthcare worker is really dealing with in a day-to-day intense situation.
Again, a lot of it is just, we've always used gloves and masks, but now you're dealing with visors. You're trying to think about what mask is best for the patient that's in front of you. You're really mindful of how, the real risks are as you're taking a lot of this equipment on and off and putting it on properly and taking it off properly. Once it's properly on and I'm engaging with the patient, I'm quite safe. But as I start to exit rooms, I start to change over certain elements of my personal protective gear. There's a risk then of making mistakes that lead to contamination and making yourself sick, or carrying it into another room where you might make another patient sick or a colleague sick. And so you're just really mindful of how you're moving and navigating through the environment and through your clinical care days in a very different way. I think people, and so many different things. We're still providing a lot of, not nearly what we were, but you're still having to deliver babies. You're still having to do emergency surgeries. You still have to put on fractures. You're still having to sew cuts. And so all these things that you've done hundreds, thousands of times in your career, you're having to just think about it through the element of this person either is or could be positive. And so how do I change, or how do I protect the patient, protect myself as I go about something I may have done thousands of times before? And, delivering a baby, nobody's not delivering a baby because it's a pandemic. And some of those people need C-sections, some of the, it's just, that is very much something you can't ramp down obstetrics. Mental health is another area. How do we deal with that issue? huge mental health, both for our community at large, our patients, but I think a lot about the mental health and the mental well-being of our frontline as well.
And how long, when you think about your hospital and where you're situated and the number of cases that your province has, I mean, do you see an end, or are you just trying to, are you taking it day by day? Where is your mindset at?
So again, earlier I probably didn't finish the thought, but I talked about, there's sort of three phases. So one phase was building all of this critical care, and that was my fault for not finishing my thought. So first of all, we were building all this sort of critical care, intensive ventilator capacity. Now we find ourselves really, really focused on long-term care home, retirement homes, homeless shelters. But then, simultaneously, we're also saying, okay, well, what does a new normal look like? Or what does the next stage of trying to get our care system more opened up look like? And it's an incredibly complicated question because there's, again, a lot we don't know about this disease. And it's not just about the disease, right? As we start to go back, there's going to be pressures on the system. So I think one of the things we all read the most about is the growing wait times for surgery, cancer surgery, other needed surgery. But you have to remember, as you start to open up surgery, you're starting to do some of the really high-risk procedures, like helping put people intubating, putting people on breathing machines for the operation, taking them off. Those are high-risk procedures. You're going to need a lot more, we use gloves and gowns and all that stuff, and we know there's a global shortage. So as we ramp back up, there's going to be pressures there. We know as well that there's global shortages of certain types of paralytic drugs or anesthetic-related drugs, and as you ramp up surgical capacity. So these are very, very complicated questions. People understandably are going to want to have family and loved ones help them through this process and be at the bedside and the recovery. That's not necessarily going to be appropriate either. So it's not just as simple as saying, okay, let's start operating again. There's a huge ripple effects, especially in a world that's still very much, grappling with global supply issues on, hand sanitizers and cleaners and anesthetic drugs and masks and gowns and gloves. And as you increase the capacity or the throughput through the system, that supply chain will be strained again. And then there's issues of safety and protection, and how do we do procedures that we knew how to do in a certain way before? How do we do them in the context of patients potentially or actually knowing that they're positive?
And I mean, what you're describing is it applies to every country.
It does.
Everywhere.
Absolutely.
We all need the same things. We all need in order to, wow, that is an overwhelming idea. Yes.
Breast cancer, doing a lumpectomy and an axillary dissection, taking out lymph nodes, that's wherever you do that in the world. You've got to think through these same issues. If you're going into, put somebody to sleep and put them on a ventilator, that anesthetist and the other people in the room are having an exposure risk that you really need to think about wherever you are in the world right now. I guess there's New Zealand today. This will timestamp this podcast. But New Zealand today announced they have no more new cases, and that's amazing. But that's not where most of the world is at. And again, how does New Zealand maintain that going forward? Helps to be an island.
It does help to be an island.
But those airports are going to open, right?
Yeah, absolutely.
And those ferry ports are going to open again. And
yeah, we are very modern, and we travel, and we can be somewhere pretty quickly, and so can the virus, really.
And in huge numbers. We're not talking about 30 or 40 people. Airplanes and boats can carry. These airplanes can carry huge numbers, multiple flights. So we're a mobile world. And as that be returned to that mobile state, especially, one of the horrible turning points, I think, in this disease was realizing how much asymptomatic spread there is. I think for me, that was a day my heart just sank. That was a heartbreaking day when that study came out with Center for Disease Control that said, there is a large amount of transmission that happens when people have no symptoms or exceedingly mild to the point of not being really self-aware of it. Because that day was a huge game changer in how we think about this disease.
Right. And I guess it also speaks to just how sneaky viruses are.
Yeah, and also just the challenge of knowing what we're dealing with. I think our knowledge has changed so much, and as a hospital CEO, I spend a lot of time thinking about frontline clinical care, but huge kudos, huge shout out to the epidemiologists, huge shout out to the basic scientists and the researchers. There's so many people working on this from many different facets, from cures to vaccines to cellular level research to, there's just so many elements to how we go about thinking about this.
Can we talk a little bit about vaccines?
Sure,
So your hospital is part of a clinical trial, is that right?
So we are involved in no, I don't think we're in a vaccine clinical trial. We're in some of the plasma clinical trials. I'm not sure so that's actually trying to look more at a sort of a treatment approach than a preventative vaccine approach. The goal of a vaccine is to prevent you from getting the disease. Some of these other trials are looking at curing you once you have the disease. And so I don't know, I'm not up enough to speed to know how many vaccine trials, if any, are currently underway and at what stage they're underway, if they're even trials in humans yet. I'm not aware of that, but there might be. I'm just not aware of it.
Right.
But the vaccine we're probably a little ways away from still. And again, we don't know if this is going to be can we get a vaccine? There's diseases like HIV that we've been battling for 30 years now, maybe 25 years, to try to get a vaccine on and have not been successful. So can we even get one? If we do get one, will it be one stable vaccine that is relentlessly effective? So, you think about the measles vaccine that a baby gets today is essentially the same vaccine you got. I mean, you're only 24, but so the point is some of these vaccines, whereas the flu vaccine has to change every year. So can we get a vaccine, and will it be a stable vaccine over time, or is it a vaccine that will need to be redone every few months or every year or more or less often? And we need boosters, we need like your tetanus booster, and will we need boosters and how often? And so, there's so many questions around the vaccine still to be sorted out, but obviously good work underway.
Yeah, and I think that we live in a time now where you have a headache, you take a pill. You have this, you take another pill. You have this, we're used to that. That's how we all kind of grew up. That there's something to take for every ailment, and now all we're hearing about is life won't go back to normal until we have a vaccine. So there's all this pressure on a vaccine, but they don't appear overnight. They take months, if not years, to develop.
And again, lots of uncertainty about what that vaccine looks like. Even if you can get one, what's its functionality going to be? Will it be like the flu with a partial effectiveness that has to be redone every year? Is it going to be like tetanus where you get it, but then you have to update it every 10 years or however long? Or is it going to be something, where once you get it, you're pretty good?
Right. So, as a physician, when you see, groups on the news who, are trying to get life back to normal, and this is all, bogus and all that sort of stuff, how does that make you feel as a physician?
It's hard because I absolutely get it. I have friends who are unemployed. I have friends who are losing their life's work. We have people who see their whole stability going through. One of the really, again, another real heartbreaking moment that was just a couple weeks ago. We work a lot with our community-based organizations, and so we touch base about once a week. And we were chatting and saying, what are you seeing? What's going on? And they said, we have seen just from our community service health groups and our not-for-profit community-based groups, food insecurity is just rocketing. Just the number of people who are now depending on food banks. And, this has not been 6 months. And it just reminds you how fragile, millions of Canadians are, and that just a couple weeks without a paycheck has meant not putting food on their table. And so when I see people protesting and I see people desperate, I understand, some of it may be coming from ignorance or whatever, but I understand that most of that is coming from a desperate desire to be able to make ends meet in the most basic of ways, which is food and shelter. And so I get that drive. On the other hand, we've been overall pretty lucky in Canada. I don't want to minimize the thousands of deaths we've had, to be clear, but we have not looked like other parts of the world and other cities. And boy, let's not throw that away. And so people have done such hard work. Let's not throw it away. It's sort of like getting through this is a sort of like an ultra marathon, and you don't want to sort of get to the halfway or the 2/3 mark and think, I'm good, I'm going to just start sprinting, right? And hurt yourself before you can finish.
Yeah. So this is, I can't ask you if you've ever been through anything like this before, because I don't think any of us have ever been through a pandemic before. But is there something in your career that you could compare this to?
Yeah, I'm old enough to have been practicing medicine during SARS. And I appreciate in BC, SARS may have been less of an issue, but in Toronto, Toronto was one of the global epicenters of SARS. And so I do remember SARS, and I remember how hard that was. I wasn't working at this hospital. I was working at one close by, and I was working in a number of hospitals in rural parts of Canada. And so I do remember what that felt like as a clinician. I remember what it felt like emotionally and physically, the uncertainty. And so, I do that. And for those of us who were involved in a sort of significant way during SARS, and not everybody was, it was not a pandemic in the same way that this is. But I can tell you, North York Hospital, where I am, was unfortunately one of the hospitals that got really hit hard. And I can tell you, as soon as those first cases started in Wuhan, while other people around the world looked and thought, I can tell you, people in this hospital immediately went back to SARS. And so people here looked at that and thought something very different because they had a memory that other people didn't have.
That's interesting that you say that. I interviewed Dr. Bonnie Henry, who also was very involved with SARS. And, we talked about complacency when it comes to viruses and how you can never be complacent. It's costly and deadly. And she, when I asked her about it, she really thought that that SARS is where we would have learned to never be complacent. Right. But it didn't happen the way that, I guess she thought it would. And we do get complacent, right? I guess, I'm not a physician,
I think a couple things. There's definitely truth to that, but I also, I would nuance it a little bit. I do think there was some learnings. So first of all, two or three things. First of all, I think there was some learnings. I think we did get out of the gate a bit faster, certainly in Ontario and Toronto, where there was a pretty good sort of trigger memory and stuff. I think there was learnings, and I think we were able to do things we didn't before. The second is I think a lot of people thought this might be like SARS. And SARS, we were able, with some effort, to put our arms around it, deal with wave one, put our, settle, and then wave two, and it sort of vanished, right? Like nobody's seen SARS again. And so I think when people saw this, people thought, okay, maybe this will be a bit SARS-like, or MERS, right? And the Middle Eastern, and so I think those who had some knowledge said, okay, here we go again, but it's going to be closer to SARS and MERS, and maybe less like the Spanish flu. And so I think there were some things we did well because of SARS. And again, in North America, we have to remember the place in other parts like Africa, they've had Ebola in recent years. And, we're very privileged not to have had something like Ebola here. But anyway, so I would disagree a little bit. Like I do think people geared up more rapidly than they would have before. I can tell you our hospital certainly felt better prepared because of it and more faster out of the gate, and I think others as well. But I think we didn't quite see this type of huge pandemic. I thought people rightfully hoped, that it would be more MERS and SARS-like. Or Ebola, the way Ebola ended up in North America, which was, a handful of cases, if memory serves.
Right. And we're, as you said earlier, we're, still learning about COVID-19.
Absolutely.
And, I'm reading articles out of the Guardian now saying that they don't know if you can get it a second time yet, whereas 2 weeks ago, they weren't saying that. They were saying you were fine. So it's really interesting how it evolves every day. Yeah. How do you stay on top of it all as a physician in a hospital?
There's no shortage of information. The challenge is, I think, triaging it, not getting overwhelmed, going to sources that I trust, using trusted aggregators of science and sort of really paying attention to the evidence and not some of the garbage out there. And there's, from some of the highest authorities and leadership, we see bleach and stuff. So but the other thing is, especially after the first 2 or 3 weeks, I had to start to also make sure I wasn't just, it can become overwhelming and emotionally overwhelming, and you have to be able to function. So, I try to figure out what I need to know to run my hospital and to be a good doctor, what my patients need and what my team needs in those roles. And so I'm not up on the very, very latest vaccine stuff. I have a sense of what it is. I have a sense of the options and the criteria, but I couldn't tell you every vaccine hospital or vaccine research lab in the world right now and where they're at and what they're doing. So you have to parse, you have to triage, you have to go to needed sources, and you have to protect yourself against the intellectual and emotional weight of all of this coming at you.
That's really good advice. So moving forward, or let's just say being present, what is your message to Canadians right now as we're, are we in the middle of it? Are we in the beginning of it? Do we even know? What message do you have?
I think we're partway through, or, we might say 2/3 of the way through the first act. And so a couple things to keep in mind. Number one is we're not through the first act, and we can't throw the first act away by getting ready for what we think might be the second act. And so, again, people are talking about early May, mid-May, end of May, June. We can't start acting today like we hope to be acting in 4 weeks. That's a long time for this virus, right? And so we can't say, well, they're going to do this in 3 weeks. Let's behave that way today. No, you got to wait. That's why it's 3 weeks, and you got to hold. That's number one. Number two is you still got to hold on to the basics. Hand hygiene. Don't touch your face. Hand hygiene. And how do we really do that? And how do you really go back to the basics and be relentless? And in fact, the more we start to do stage opening in the weeks and months ahead, how do you go back to that stuff that we were doing before lockdown? And how do you go back to that really, really important basic stuff around hand hygiene, not touching your face? We're still going to have to socially distance, et cetera. So how do we do that? And then the third is that we have to continue to be comfortable with uncertainty. And, that is really hard. We all like certainty, and we're not going to get it. We haven't had it for the last 2 months, and we can't expect that we're going back to normal. We're going back to something that looks different than normal. And then it's going to be different again, because we're going to learn more, and we're going to learn different things, and we're going to have to change and adapt again. And so how do we continue to build our resiliency in the face, not just of adversity, but of uncertainty? Because I think uncertainty is very corrosive. And so how do we get comfortable knowing that we might have to take 2 steps back? We might open it up, and suddenly we're going to have a flare, maybe not everywhere, but somewhere, and we're going to have to pull it back again, or we're going to find out something new or different. And so that's the other thing I think we have to brace for. And if we can be comfortable with that now and not be surprised when it happens, it'll be emotionally easier. It's sort of, When you tell patients bad news, the more I can sort of create a narrative where that doesn't come completely out of the blue, it's easier because they've digested that possibility or that uncertainty in pieces. If I tell somebody ahead of time, this CAT scan may not give us the answer, this is what happens if it doesn't give us a clear answer, then when the test result comes in and I say, well, we're not sure, they're like, yeah, I thought that might happen, or you warned me. And yes, so how do we condition ourselves? And I'm glad we're spending a few minutes talking about it, because I do think the next several months are going to be a lot of trial and some error.
Yeah, that's really, I think that's so important that you point out about uncertainty, right? Because I think that's what we're all feeling so uncomfortable about, is the unknown or the fear or the, what's coming next. Yeah. And that's really powerful, right? About uncertainty.
How many times have patients told me, if it's cancer, just tell me that, right? Let me figure that out. Then you can tell me if it's curable or not curable. Right? Like, just tell me, right? They want people, I get that, right? And patients people want certainty in all parts of their life. Do you love me or you don't love me? Are we going to move forward in this relationship or are we not? That's, if we're not, okay, I'm crushed by that.
Just tell me.
Tell me, right? I'm crushed. And so that uncertainty is so corrosive. And so the more we can acknowledge, it's not just the hardship of not seeing our loved ones. It's not just the hardship of not taking our kids outside. It's the corrosive element of uncertainty that I think we don't acknowledge enough. And B, we don't acknowledge the hardness of it. And also the reality that we're probably still going to have some uncertainty.
Yeah. And I mean, you make such a good point, because we all like a finish line, right? We all like to get to the finish line, put a bow on it and toss it away and it's done. That is done. And I think we'd all like to tie this one up and move on. But you make some really, really important points. And I really appreciate the time that you took with us. I know how busy you are.
My pleasure.
You guys have a new online assessment tool, right? So can you just talk a bit about that as we wrap up?
Yeah. So again, one of the things that's at the cornerstone and has been in every country around the world is this testing. How do we test? We're not, I think everybody's agreed nobody's doing enough testing. People talk, maybe South Korea does enough testing, but, North Canada has not tested enough. The US has not tested enough. And a key part of getting back into opening our healthcare system, opening our economy, opening anything is going to be our testing capacity. So we're trying to build that testing. And there's a lot of things that people don't realize. You have to have swabs. You have to have people to do the test. You have to have swabs to do the test with. You have to have reagents to process it with. You have to have machines to put the reagents in. There's a lot of things to have. Then you need to be able to get the answers out of the machine and communicate it to people in an appropriate way. So there's a lot that goes into our testing capacity. And we need that up and running. But we also want the right people to be tested given limited capacity. And so our tool that you've talked about is an online way that people don't have to leave literally the safety of their houses and their homes to be able to come in to be told, no, you don't need a test. So you can go on, answer some questionnaires. You can put in your postal code and it will tell you what's the nearest testing center. And we update it all the time as the testing criteria change. And as we're testing more or different people, we update the tool so that people can get answers.
Awesome. Okay. And you can look
on our website.
You can go to COVID-19Toronto.ca, COVID-19Toronto.ca. Thank you so much, Joshua, for your time.
My pleasure.
I really appreciate it. And be sure to join us here on TELUS Talks with Tamara Taggart every Tuesday and Thursday.
Great. Thank you so much and be safe.